Okay, good night. And once again, yours truly, Dolphy Alexander Gilpin, coming to you from 1524 LaVista Drive, Decatur, Georgia, United States of America. And I'm on random medical topics, medical abnormality, sometimes the anatomy. And tonight I'll be dealing with COPD. Let's write it here. COPD. And COPD is referred to as now chronic obstructive pulmonary disease. CHRONIC. Obstructive pulmonary disease. And this is a group of lung disease characterized by increased breathlessness. Breathlessness, sometimes called dyspnea in medicine. So it's a group of lung disease characterized by increasing breathlessness. And it's also an umbrella term for progressive lung diseases. An umbrella term for progressive lung disease. It's sometimes called cold. This is not the common cold, no, but C stands for chronic again, O stands for obstructive, and S stands for lungs, and D stands for disease, cold, but not the normal common cold, but chronic obstructive lung disease, but it's pronounced cold. But you usually see it more in as COPD, chronic obstructive pulmonary disease. So as we say, it's an umbrella term used to describe progressive lung disease. An umbrella term used to describe progressive lung disease. Now, among these common lung disorder are what you call now emphysema, chronic bronchitis, asthma, bronchiectasis, and cystic fibrosis. Now, diagnosis of this COPD, or chronic obstructive pulmonary disease, and we note also that COPD obstructive, it can also be restrictive. So we later on integrate these restrictive characteristics in it. And so that now the obstructive and restrictive lung disease can be diagnosed using a pulmonary function test. So let's write this now, pulmonary function test. And in this pulmonary function test now, what we have is the person breathing, blows forcefully through a mouthpiece, and the machine records the volume and flow of air through the lungs. So the person blows forcefully through a mouthpiece, and the machine measures the volume and flow of air through the lungs. And that is now pulmonary function testing can identify obstructive and restrictive lung disease. So we know that it can identify obstructive and restrictive lung disease. And also it can I also differentiate the severity of this obstruction or restriction. It can also differentiate the severity of obstruction or restriction. Yeah, that's a pulmonary function test. A person blows forcefully through a mouthpiece, and the machine records the volume and also the intensity of the airflow through. And the machine records it and also differentiate the severity of the obstruction or restriction. Now, during diagnosis, what the doctor could do in the history, you would ask for the history of smoking. You do a physical and a lab test. Physical exam and lab test. Imaging test. Which include now chest x-ray, and computer tomography scan. Also, we could use now in diagnosis a process called bronchoscopy. Which a doctor use now an endoscope to look inside the airways and take samples of lung tissues. The doctor uses an endoscope to look inside the airways and take samples of blood tissues, which is a biopsy. You know that the endoscope is a flexible tube with a camera and tools at the tip to take the tissue sample. Now, as we say now, symptoms of the COPD is shortness of breath, cough is very common, and in both restrictive and obstructive lung disease, usually the cough is dry or productive with white sputum. And people with chronic bronchitis or COPD may cough up large amount of colored sputum. So you have white sputum. And with chronic bronchitis now, could have no colored sputum. So, symptoms of depression and anxiety also are common to obstructive and restrictive lung disease. All right, so we'll move on now to treatment. And we have no bronchodilators. Which improve the airflows and release smooth muscles that are in the wall of the airways. So you have bronchodilators that improve the airflow and release smooth muscles. Relax. Smooth muscles. After the lining of the airways. That's what the bronchodilators does.